Good afternoon. My name is Chris Nelson. I'm the Communications Director for the University of Utah, and I want to welcome you to our first town hall meeting of the spring semester. Today, we are joined by a variety of experts, including Dr. Lori McDonald, who's the Vice President for Student Affairs, Dr. Stephen Lacey, who's the Chair of the Division of Public Health at the University of Utah School of Medicine, Dr. Dan Reed, who's the Senior Vice President for Academic Affairs, and Dr. Tom Miller, who's the Chief Medical Officer at the University of Utah Health for our hospitals and clinics. And we'll go through our spring testing plan, answer some questions that have been submitted. But before we do that, I want to introduce President Ruth Watkins and give her a few moments.
Thank you so much, Chris, and thank you all for taking the time to join this conversation today. I want to extend my welcome to the spring 2021 semester, and most of all, let you know you have my warmest appreciation for everything you have done to help us continue to keep the important work of the University of Utah happening through a pandemic. Your actions have made an enormous difference. Your actions of participating in testing, of following health guidelines, such as physical distancing, wearing a face covering, and of course, frequent hand washing. And as I understand things, the experts today will tell you more, but it's pretty important that we keep that behavior up as this spring semester continues. So thanks in advance for what you're doing. I want to also express great appreciation for the many people around the campus who have worked hard to enable us to do much, much more testing this spring semester. You're going to hear a lot about that today. Testing is one critical tool in the toolkit, and we know it will help us as we continue through the semester. Now, my great hope that semester of 2021 spring is the semester we begin to see this pandemic recede. Your help will make that happen. On a personal note, I have been so privileged to be a part of this campus community with you. And I'm so happy that I'm going to be here through the spring, most of the spring at any rate, and so that I can have a chance to tell you that more personally and in the future. So thank you, everyone. Thanks for taking part today. Chris, back to you.
Thank you, Presidents. All right, Dr. McDonald, let's get to it. Today's audience is both students, but also faculty and staff. But let's start with the student testing plan. I know a lot of work has gone into it over the winter break, and kind of some exciting news and a lot of resource coming to bear. So I'll turn it over to you to kind of give the breakdown of how it will work.
Thank you so much. I am very excited to talk about a lot of developments. We have been learning a great deal throughout this entire pandemic, and we benefit so much from research, from our academic medical center, from all of the experts who are putting in so much time and effort to help our campus community maintain our health and get through this as best as possible. And I'm excited to talk about the mechanics of the testing. I know Dr. Lacey is going to talk about the importance of participating in this, and so I'm just going to let you know the operations of it. All that I'm going to be covering is available at alert.utah.edu/COVID-19-testing. That's the alert testing page that will continue to have updates and details. This will all be included there.
Dr. McDonald is also available at coronavirus.utah.edu if that's a little bit easier. That will link to the site.
Good. My next is the coronavirus.utah.edu site continues to have additional information, even more than just testing. And there is a link to this alert page from there. So yes, thank you. As a reminder, symptomatic testing and testing for those who have been confirmed to have been in close contact with a positive case continue. And that for all students, faculty, and staff, in order to schedule a test for those situations, we ask that you call the University of Utah Health and Testing Hotline at 801-587-0712 to schedule a test at an appropriate testing location. And they can assist with answering a number of questions about symptomatic questions and contacts. So we also ask, and we are continuing to ask our campus community members to complete a self-report form in those situations at the coronavirus.utah.edu website. This will help us start some support resources for the individuals involved, and also initiate some protective protocols for spaces on campus and things like that. So those continue the same as they were in the fall. New to spring semester is asymptomatic testing at no cost for our students, faculty, and staff who are coming to campus. This testing will be done at 2 different locations on campus, the Officers Club in Fort Douglas and the Saltaire Room in the Union Building. Tests do need to be scheduled with an appointment. And with a great deal of appreciation for our research core labs, we're using a PCR saliva test. Results will be emailed to our UMail accounts within approximately 24 to 36 hours. So those are the locations. Now there are certain populations of our students that I want to talk about. For our students who are living in housing and residential education facilities, we are requiring weekly testing. Our HRE students have already begun moving in as of today. And so as of today that we've started the weekly testing. They have a dedicated link on that alert testing page to schedule those appointments. And there's also a frequently asked questions page for our students who live in housing and residential education. So for students who are not living in housing and residential education, for those who are registered for some type of in-person class component, an in-person class or a hybrid class that does have them on campus for some periods of time, we are expecting all of our students to participate in weekly testing. Every Thursday, they will be notified via their at utah.edu, their UMail address. That account will have information about how they can schedule a test for the following week. We really strongly urge our students to participate in this regularly. And along with that information, there will be further details and some frequently asked questions. We can get some answers to them. But again, those are taking place in the Union Building or the Officers Club, but they do need to be scheduled by an appointment. We also have testing available for our students who are all online, who are here in the area, who are concerned about a test but may not be meeting the criteria for symptomatic or having been in direct contact. Those can also be scheduled at that web page. These students will not be sent a weekly invitation to set an appointment, but they can do so on their own through that alert testing page. With a similar approach to our students who are coming to campus for classes this spring, we're also offering available optional testing for our current faculty and staff, including healthcare employees who may not have been identified as in close contact by a contact tracing team but still have concerns. Those appointments can also be scheduled at the alert.utah.edu/COVID-19-testing site. And for all of our campus community, we offer a number of support resources for our students, especially who are positive or have been in contact and need to quarantine and isolate. Our contact tracing team has a number of support resources both on campus and in the campus community. Our Center for Student Wellness has a list of a number of resources and events that are going on throughout the semester at wellness.utah.edu. And we really want students to reach out if they have any questions or concerns. We want you to be successful while going to class, but also participate in all the public health strategies that help our campus community be safe. And we're here for you. So.
Excellent. Lots of good information. If in doubt, again, coronavirus.utah.edu. And Dr. McDonald, also special thanks to our research and laboratories on campus who are participating and making this greatly enhanced bit of testing available from last semester.
Absolutely.
All right, Dr. Lacey, so we've heard a lot about, we're offering the tests, but the tests, that's not the solution, this is part of a solution. Why is the testing important, and what are the other things we're still encouraging students, faculty, and staff to do this semester?
Yeah, thank you. I want to talk about the rationale. Also, as we kind of close out the mechanics that Dr. McDonald was talking about, the core labs have been incredible, but also Richard Orlandi and Cameron Wright, along with many other people. But Richard and Cameron have been outstanding in working out the mechanics of this, and it's been a real team effort to hammer out the details. So I'm really grateful for their work. About the rationale on this, testing helps us understand the extent of infection in a community at any given point in time, and also the rate at which infection is spreading from one point in time, say from week to week. So knowing how many infections there are and how fast that infection is spreading to others helps inform strategies to contain the virus and helps us plan to take care of the people that become sick from the virus. Also, and equally important, by identifying those individuals that are infected, we can help prevent them from infecting other people by having them stay home. So remember from earlier conversations, we isolate sick people from those who are not sick, and we quarantine people who have been exposed to see if they do become sick. And what's interesting about the role of the U within our broader community, the university is physically at the heart of our city. And the people that work and study here make up a big part of our larger community population-wise. But the thing is that the U is not a fortress surrounded by high walls. It's porous and people come and go. Within an hour, a student or a professor may go from campus to the grocery store and then back to their neighborhood. So they're really part of different communities. For one moment, they're part of the U. For a next a moment, they're a shopper. And then the next moment, they're a neighbor, perhaps to those that are most vulnerable. So this testing plan is going to help us prevent and protect our larger community as being such a central piece to our larger community.
Excellent. And everything else stays the same though as fall semester, wearing masks, physical distancing, creating your social bubble and staying with it, correct?
Yeah, absolutely. All of those elements stay in place, and perhaps they're more important than ever. Across the country, there is uncontrolled community spread, right? We've seen this, we see this in the regular updates, and we have to keep doing the things that we know work. You're going to hear this 3 more times probably before the end of this conversation. Masking up and keeping distance from others. Sometimes we kind of conflate those things, think that if we have a mask on, we can get right up to someone in line in the grocery store. But masking and physical distancing and hand washing, and perhaps most importantly, staying home when you can, those things have to continue to make this work.
Yeah, I wanted to ask you, give you a chance to talk about some really special unsung heroes that report up through the Division of Public Health that you oversee as our campus contact tracers, who I think have probably the busiest and maybe one of the hardest jobs. Can you talk about why it's important when people get contacted by this group? It's important to respond and just some of the work they're doing.
Absolutely. I'd love to talk about the importance and to brag on this team for just a second. Contact tracing is led by 2 professors from the Division of Public Health, Sharon Talboys and Kim Schoaf. They've trained literally hundreds of contact tracers to do this work across the state. And then they've created a specific team dedicated to our campus. And all of them are acting as an extension of the Utah Department of Health. So when an individual self-reports or they test positive in this testing strategy that we've been talking about, that initiates a set of phone calls to determine who they've been in contact with. So let's say if I test positive for COVID today, someone from Dr. Talboy's team would call me and they'd ask about all the people I've come in contact with around my time of likely exposure. So if I got called today, I would say, I've seen my neighbors, but I've seen them from across the yard, and I passed someone on a trail on Sunday, but we both gave each other a lot of room. So I saw someone, but I wasn't within distance of them. And then that contact tracer will determine if anyone else needs to be called or if the conversation stops there. Usually there are more phone calls to make. And then when they make those calls, they might be given additional advice to those individuals, like staying at home for the next several days. So to that end, it's really helpful to keep mental tabs on where you've been and the people you've encountered. Again, for me, it would be, I saw my neighbors, and I pass someone on a trail. Having that sense of who you've been around is going to be really helpful to this effort. And I know robocalls are annoying, but please answer your phone. A contact tracing call will look a lot like a call from campus. It has the same couple of prefixes that our campus uses. So keep an eye out for those calls, check your messages, and they also may text you. Our contact tracing team is doing amazing behind the scenes work, right? They're literally saving lives with phone calls, and we need the entire community to help them out by picking up the phone. It doesn't work if people don't pick up the phone.
Excellent. Yeah, and kudos to that team. And again, the great news this semester, as we're announcing today, is if in doubt, we're offering asymptomatic testing, and so
Correct.
it's available and a resource that being kind of an advantage of being part of the University of Utah community. Dr. Reed, we know we've got faculty who've got questions, who'll be returning to the classroom, teaching online. What are some of the big issues that you're hearing from faculty, and what's the message to that audience?
Well, first of all, I think the message to our entire community is a huge thank you. Thank you for diligence and compliance with all of the guidelines that Stephen just enumerated about face coverings and social distancing and washing your hands and trying to work at home if you can. So just a huge thank you to everyone who helped make the fall semester a success. It's important that we continue to do those things for the spring and maintain diligence. But I want to also echo just a broader thank you and remind folks what Stephen just described, what Lori just described, are really part of what a great public university can do in a one-use spirit. The fact that it's our research enterprise that's supporting testing, and that we have a Department of Public Health that has this expertise, it's really about a one-U partnership, and it takes all of us to make these things happen. As we think about the spring semester, for your faculty, remember that overall, somewhere between 40 and 50% of our classes have at least some in-person component. There are a bunch of classes that are entirely online, but laboratory, experiential education, the classes that meet in hybrid mode, there are many faculty and students who are on campus maybe one day a week. And so everything that VP McDonald described about testing is really important. I'm really excited that for faculty, testing is now available really on as they feel the need. And so if you're concerned, it is available. It's a way to provide some reassurance and to short circuit exactly what Dr. Lacey was talking about in terms of knowing early if you might be infected. So please take advantage of that. And we are already planning for the fall. Dare say we see hope on the horizon with vaccines, but in the meantime, it really is important to be diligent and maintain those practices. We will, with respect to the fall, take stock in the spring about how we adjust some of our parameters for fall instruction. We just need a little more data. So please be patient and diligent as we continue to watch the spread of the virus and the rollout of vaccines and the testing availability. And those of you who are teaching, just a quick reminder that Teaching and Learning and Technologies and the Center for Learning are both available. If you have pedagogical needs, they're happy to help in any way, whether it be supporting student accessibility, which is an important issue as we think about often the Zoom-based electronic delivery for so many reasons, but those resources are available. But my overwhelming message is one of incredible gratitude for what you've done. Stay the course. The end is in sight, but it's not here yet. We will get through this together. That's what partnerships are all about. So thank you. And let's look forward to a spring that is as successful and even more successful than the fall.
Thanks, Dr. Reed. And again, specific questions from faculty, you can go to coronavirus.utah.edu. If the information is not there, there's a hotline to call, just a central point for information. All right, so a lot of questions we've had about vaccines. When is it going to roll out to the community? How's it going on the healthcare side of things at the university? And so, Dr. Miller, thanks for joining us. Can you give us an update on vaccine rollout? Maybe start with how it's working on the healthcare system, and then as a practicing physician and administrator, what do you expect to see for vaccine rollout to the rest of the community, including the campus community down the road?
Yeah, so thank you, Chris, and thanks to all our campus participants. I'd like to sort of echo what Dr. Lacey was saying, that currently our symptomatic testing rates of positivity are very high in the state. They're around 30%. And given that vaccine rollout is slow, based on a slow supply from the federal warehouses where the vaccine is stored, we can expect the sort of trickling in of vaccine over the next 30 to 60 days, but then larger amounts after that. So again, to Dr. Lacey's points and some of the other recommendations that have been made, please, please, please wear your protective equipment when you're in areas that require it. So if you're, in classrooms, especially if you're outside, and then especially if you're with family and friends. I call this the tribal effect. We feel safe. We feel safe when we're with our families, when we're with our friends and our close friends. We don't quite feel that way when we're out in grocery stores and other places, but the place or the areas where the virus is passed is when we take those masks off and spend a little while together with friends and family, as you see sometimes over Christmas among families. And it's normal, it's natural, we expect that. I'm making a plea for all of us to get to the finish line. We're sort of at that mile 20 of the marathon, and we got a few more miles to go. Let's hang in there. Let's wear those masks. Wear the masks. They do work. They do work. Keep them over the nose and the mouth. This is a pain, I understand. And when we get through this, we can all throw them away in a big, big party. But it's going to be a few months. Okay. Regarding vaccine, as many of you have seen, well, some of you have seen, the CDC recommendation for distribution was to begin with healthcare workers. And the university started vaccinating healthcare workers with their first dose of the vaccine around December 15th. And we vaccinated about 14,000 of our 19,000 employees. We expect about a 30 to 80% uptake. Remember that the use of the vaccine is not mandatory because it's under emergency use authorization, meaning that it hasn't met the highest standards of approval. So it will get there. The vaccine in 2 doses, and there's 2 of them on the market right now, Moderna and the Pfizer vaccine, which the federal government has bought up in very large quantities. And it's being produced as we speak and then shipped out. The 2 doses of both of these vaccines are 95% effective. The second dose is taken 21 days after the first dose, and for the Pfizer, and then 28 days after the dose of the Moderna. So that's where we are with university healthcare staff. And what the governor has done, and he executed an order on Monday evening, and all of the vaccine that's coming into the state, and let me tell you, there's only about 33,000 doses a week that will be coming in per week. So if you look at our entire Utah population, that's kind of a trickle. So we've got to kind of just hang in there. Now, remember, we've been in this battle for 12 months already. We will get through it. We will get vaccine, but it's going to take a little while. And as I said before, I'm very hopeful in the next 30 to 60 days, there will be more and more vaccine available. What the governor stated is that this week, the week that we're in right now, he's vaccinating K through 12 teachers. And we are having groups go out to not we, but the state is having contractors go out to the schools and vaccinate the teachers. There are about 100,000 teachers, so that's going to take a little while. Starting next week, they continue with essential workers and the teachers and those 70 years and older. And the shots will be delivered through the county health departments. In his executive order, they did not include preschool personnel, nor did they include college professors or staff. Obviously, that'll be coming, and that's a concern to everybody, but that's kind of where the executive order is right now. There are about 410,000, that was stated in the executive order, in the population that comprise the 70 years and older and the essential workers. So at our current rate for the foreseeable future, it's going to be hurry up and wait. And what I mean by that is vaccine will be distributed to the local health departments and then some of the contractors. And then it will go out very quickly because there are about 25 local health departments throughout the state that will receive vaccine. Obviously, the biggest populations here in Salt Lake County. There are several county health departments that will be administering what vaccine they receive, and then they're done, and they have to wait for the next shipment, and the next shipment, and the next shipment. We expect by the end of the month that the two newest vaccines, these are the adenovirus vector vaccines from Janssen and then AstraZeneca, will receive EUAs and then be open to the market and then shipped. And so that'll increase our supply. So look for that. The efficacy of those vaccines has not been determined yet. We'll hear about that later. So I guess in conclusion, I'm saying we will get the vaccine, but we're going to have to hold fast right now. And that's why I kind of fall back on Dr. Lacey's discussion about the complete importance of wearing your protective gear now, especially when around your friends in the dorms, in the classrooms, and with family. So let's get across the finish line. We can all do this. We will get vaccinated. There's vaccine. It's coming. We're going to have to wait, grit our teeth, run to that 26-mile mark, and then we'll all be vaccinated.
Dr. Miller, one of the questions we received, and I wanted to bring up for you, Dr. Lacey, is even someone who might have been vaccinated early on, it's still important that that person is masking and the physical distancing.
Yeah, that's Chris. That is a very good question. So there is a sense, let's party after you get that first vaccine. So right now, again, we have the Moderna and the Pfizer. Those are 2-shot vaccines. After you get that first vaccine, your immune system takes a week to 2 weeks to maximally respond to the vaccine. In the first dose, at the end of 2 weeks or 3 weeks, when you're ready for the second dose, you are only about 50% protected. So goes to the point, you get that first shot within the first week, you're not protected. In the second week, you can start to assume that you have some protection. But it's not until at least a week after that second dose that you reach that maximal efficacy of the vaccine, which is 95%. So the point is, wear the masks. Don't think you can take them off. Now, the next thing is, all right, let's say you get both doses of the vaccine, and then hopefully the Janssen vaccine was a 1-dose vaccine. So that's going to be great. It's easy to distribute. So hopefully we'll get a lot of that. But we're still, even though we reach that period of time where we know we have maximal efficacy from the vaccine, we have to do our part in continuing to wear masks until everybody else is vaccinated. Why? Because it sends mixed messages. And if you're not wearing a mask, others are saying, well, I don't think I need to wear one either, whether they've been vaccinated or not. And then you get a lot of people opting in and out, and that's what the virus loves. I'm not trying to humanize something that's just a few DNA or RNA particles, but it doesn't care. So we need to wear our protective gear beyond the time that even the vaccines are maximally efficacious until we have a large enough percentage of the population, and we'll know, and the state epidemiologists tell us, look, it's okay, we're done. That's probably not going to be till June or July. Okay.
And Dr. Miller, if I may, it's even more complicated than that as well, right? So even after you get vaccinated, and especially during this time period when very few people are vaccinated, we have to keep these practices up, these defensive practices up, because right now we don't know if a vaccinated person can still infect another person. There's still some question around that.
There is.
So it may be the case that while someone receives the vaccine, won't get sick, that person will, with what you just described, they won't get sick. But we don't really understand about their ability, someone that's been vaccinated, their role in still spreading disease, because asymptomatic individuals right now are is the driving force of
that's true. So again, the whole point is, even though we will be protected to a very high degree after the second vaccine, and perhaps the first vaccine of the adenovirus vaccine, we have to do our part to continue, our duty to others to protect them. And that also is simply messaging, messaging by wearing a mask, displaying the fact that we're all in. more than anything. Wearing that mask is a badge that I care about other people. I care about those who aren't vaccinated. I care about preventing the spread of this disease. And that's tougher, because once you think you're ironclad, your tendency naturally is like, I don't need this mask. Let's do it for other people. We've been kind of talking about this throughout the pandemic, is wearing the mask, if not for yourself, it's to protect others. It's to protect the vulnerable. It's to protect those who we know are at high risk. It's to protect our grandparents and our parents and those we know that they'll have much higher rates of hospitalization and morbidity and then death if we're not careful with them. So for all those reasons. And then finally, I would say the studies that have been done to date, one of them was on a large US aircraft carrier. 40% of young folks who get this don't have any symptoms. And I can tell you, over the last week, my patients are coming down with this and they don't have very many symptoms. And we have some people in the office that have had this and they have very few symptoms. And so you don't know when you have it. Sometimes you don't know. Somebody will say, I just lost my sense of taste and smell. That was the only thing. And then you knew that they had it. Others, nothing at all, but they were positive. So again, to your point, Dr. Lacey and others, please keep wearing the masks. And, we'll get through it. People will get vaccinated. You will be safe after you get your vaccines, but let's protect others and let's continue to message to the population as a whole that this is really important.
So Dr. Miller, bottom line right now, patience is key. And the question I think we've gotten is, will the university as an entity play some role in mass vaccinations? And I think right now the current plan is no, but perhaps more to come on that.
Yes, so we stand ready to assist the state and the governor in deploying vaccines. We have in our healthcare system 81,000 individuals active in the last 2 years who are 75 and older, and 115,000 between 65 and 74 years old. And we know how to deliver this Pfizer vaccine. We have -80 freezers. This is a very fickle vaccine. It's fragile, and it doesn't last beyond 5 hours once it's reconstituted. So we know how to do this. We stand ready. We're going to set up some other sites and be ready when the state asks us, when they have more vaccine, to begin to vaccinate others in our healthcare system that are using our healthcare to be vaccinated. And we can do that. I mean, we have a great IT system and we get the uploads to the state very directly and very quickly. So we're ready to help when they need our help. And we've had ongoing conversations with Salt Lake County. And then hopefully, eventually, we could help vaccinate the campus as well. But time will tell.
Last question. I'm being told to talk louder, which has never been my problem. But and I'm not sure we actually have an answer to this question. I know we'll have a very small percentage of students over the semester who probably get vaccinated for whatever reason. Maybe they're working up on the healthcare system. And I don't know if it's Dr. McDonald, or Dr. Lacey. Do we have advice? Will those students, once they're vaccinated, still encouraging them to be tested weekly, or is that something we're still looking at? I don't think we need to answer that now, but I just wanted to put that out there.
There's one thing I just throw on. It's a little bit separate. In the governor's executive order, he asked those who have had COVID to delay receiving the vaccine for 90 days after the infection. Okay. In terms of testing, I don't know that you need to make such a granular distinction. It's too hard to, just do what you're going to do. I'll tell you, our experience here is make it as simple as you can. Once you start breaking things down into that kind of granularity, then it gets complicated and spins out of control pretty quickly.
Yeah, and again, for members of the campus community watching this, if you've got those kind of questions, contact us at coronavirus.utah.edu. I think some of these will require probably some one-on-one follow-up. So, all right, with that, I want to thank everybody for participating. We try to keep these, just under an hour. And with that, I thank everybody. And again, I just emphasize go to coronavirus.utah.edu. And as we get into the spring semester, I suspect we'll be having some more town hall meetings. I look forward to seeing you all again. So with that, thank you very much.